Hi, this is David Greene, CEO of the Florida Pain Network, where we connect those in pain with the best pain relievers throughout the state, including pain doctors and pain clinics, physical therapy practices, and chiropractors. The topic for today is radiofrequency ablation for treating low back pain. Back pain is an epidemic and will affect 90% of Americans at some point in life. The direct cost of care each year is over $16 billion, and over 5 million Americans are disabled every year from low back pain. There's a lot of surgery done out there for low back pain, and only 20% of all back surgeries are successful at the 2-year point. The facet joints, almost half of the time in the low back, that's where the pain is coming from. The most common interventional pain management treatments done by pain doctors involve the lumbar facet joint by far. By far. To make the diagnosis of a facet joint problem, the first thing that a pain doctor will do, or a chiropractor or whatnot, is a patient history. And what patients will often describe is pain when they are walking or doing anything in an extension type position. I'll show you what that looks like in a moment. Um, but what you have here is these bumps on your back called the spinous processes. You can feel those through the skin. And then deeper down, these are the facet joints. There's one on the left, there's one on the right. At every level, there's two of them. They're about the size of a thumbnail, and it's amazing how something that small can cause so much pain. So this is what I mean by extension. Here on the right, where the gentleman is leaning back. If you do activities that put the back in that type of position, that's what stresses those joints. So on physical examination, one of the things that the pain doctor will do is see if that exacerbates the problem. And then check the other range of motion, neurologic exam, things like that. On x-rays and a CAT scan, the facet joints are not too hard to see. For instance, here's one where the arrow is, and then another one on the other side. And this is a CAT scan, and these actually look great. Nice joint space here, no rattiness, no bony overgrowth. This is the spinal canal, where the spinal cord is. And unrelated to this presentation, this patient has an infection here in the front of the bone. Okay, so that's what's looked for in x-rays and CAT scan. But what it often comes down to is a flip of a coin. Only half of the time can the best trained surgeons, doctors with the back tell you why your back hurts. And that's unfortunate, but that's just one of the limitations we have in modern medicine today with back pain. So here's, once again, a picture of a facet joint. There's the bones you feel coming out of your underneath your skin, the spinous processes. So we're not talking about a humongous joint here. A diagnostic facet injection, the goal is to establish the facet joint as the pain generator. So it can also provide some therapeutic help, but usually it's diagnostic as the primary goal. If you numb up a painful joint, it should relieve the pain, right? So you can know if that's causing it. But if it's not causing the pain, then it shouldn't numb up the pain, and the patient will still be having the discomfort. Or it might be something in between. The facet joint might not be the only reason the patient's back is hurting. It might also be muscle spasm or other levels as well. So there are two types of facet injections. The first one on the left is called a medial branch block. And basically what that means is you have the spinal cord coming down here, nerve roots coming out here, there's one above it, and then one below it. You're not numbing that, all right? What you're numbing is where this little branches come off that supply sensation to the joint. That's what you're numbing with the medial branch block. Okay, so that can give a lot of pain relief. The other is when the injection goes right into the joint. There's a facet joint, needle going in, and that's called an intra-articular facet injection. So it's two different ways of doing it. Looking at what a positive result would be, some say 50%. If you get 50% pain relief, that is a positive result with a facet injection or medial branch block. Now some studies are coming out showing that 80% pain relief is more accurate. And so some insurance companies actually require that you need 80% pain relief with a couple separate injections prior to approving the radiofrequency ablation. So radiofrequency ablation is also called radiofrequency neurotomy, RFA, radiofrequency procedure, medial branch neurotomy. It's quite a few different terms for the same thing. It uses the same current as radio signals, but there's no FM radio attached to the device. It can actually hurt more right after the procedure is done. The pain relief that you get from a radiofrequency ablation may last for a year and upwards of 2 years. I'll talk about that in a moment. You do need to have the diagnostic injection prior. The insurance companies will require that. And it is the most modern treatment available for facet-related pain. There are some stem cell injections that are coming into play for regenerative medicine, but this right now is the proverbial bomb, for back pain from facet joint problems. A lumbar radiofrequency is a medical procedure where the nerve is ablated, and basically that means deadened, using high-frequency alternating current. The heart muscles are not stimulated, so you don't need general anesthesia. The pain doctor may include IV sedation or maybe some Valium by mouth, but you can actually do this under local numbing only. Heat is generated around the nerve, and therefore it cannot transmit pain signals to the brain once it's deadened. So we're talking about facet syndrome or other facet problems where the joint is injured or arthritic, causing pain. So the first step is for the pain doctor to place the catheters. And usually you're talking about more than one joint. There's a facet joint, facet joint, facet joint, but you're deadening these red areas, the medial branches, okay? So as you can see in this picture, the pain doctor's placed 1, 2, 3, 4. Okay, so it's a 4-level radiofrequency procedure. The pain doctor will do then a motor stimulation check to make sure that they're only on, this is only sensory, doesn't do any motor function. So if the leg jumps, then the catheter is too close to the nerve root, then it will be moved. Once the catheters are appropriately positioned, they are heated up, and you can see here that this one's listed at 80 degrees Celsius for about 90 seconds on each of these catheters. And depending on the pain doctor's experience and training and whatnot, it may be a little bit different on the temperature and the time duration. So it's an outpatient procedure. You don't need to spend the night for this. It deadens those tiny little nerve endings that we talked about, and it can give pain relief for 6 months up to 24 months. And at that point, the nerve endings that you get ablated here, they can grow back. So the procedure can be repeated. Some studies show all the way from a 50% to a 90% good to excellent results for upwards of 2 years. The average pain relief in a very large study was 472 days, which is pushing a year and a half. That's excellent. Complications are not usually dramatic. They can be increased spasms, so it can cause actually increased pain after a procedure for a week or two. There's under a 5% chance that the pain will be worse for months, but that can happen if the nerve is only partially deadened. Okay? You may have some numbness over the injection site area. There's a rare chance of infection, and there are incidences of a spinal cord trauma from the procedure. And as mentioned, once the pain comes back from those nerve endings growing back, the procedure can be done again with similar results. The Florida Pain Network includes pain management practices, PT practices, and chiropractic clinics throughout the state. When you're on the website at floridapainnetwork.com, you'll see geographically targeted results, meaning you put in your city or your zip code, and it will show you the results that are closest to you for whichever subspecialty you desire. There's no cost to use it. There's a ton of education on the site. There's a very active blog as well. For more information, contact us at floridapainnetwork.com or info@floridapainnetwork.com. You can call us to schedule your appointments at 877-877-8556. Or if you're a practice looking to be listed, please call that number as well, and we'll get you taken care of. Thank you very much. Have a great day.